On Health Her Way, we're asking the questions you want answered about your body.
Together with our female healthcare experts, we're diving into the questions that might seem too scary, too silly, trivial, or taboo. No topic is off limits.
Join us as we talk about Health Her Way. Welcome to Health Her Way. I'm Brooklyn Elbert.
And I'm Meredith Cunningham. We are joined today by Stacy Hughes. Stacy is a nurse practitioner with Covenant Health. She is specializing in oncology and hematology at Arrington Cancer Center. In her practice, she treats many patients with skin cancer. So let's dive into that. We know about skin cancer, but something you taught us a second ago is there are multiple kinds of it. So I think a lot of us immediately jump to melanoma.
Correct. That's the most deadly type is melanoma. So, of course, that's what everyone thinks of. When you think of skin cancer, there's three I would call the most common. There are some rare forms we don't see a lot of, but there's basal cell carcinoma, there's squamous cell carcinoma, and then there's melanoma. So usually those are going to be the lesions that we see the most common on people's face, arms, chest. But again, you're correct, melanoma is definitely the deadliest form of skin cancer and impacts women, especially younger women, at a higher rate.
Is that because we are happier when we soak up the sun?
I think there's a lot of factors, risk factors, especially I think where you're raised, the culture. I think here in West Texas, we are sun-loving population. A lot of us spend most of our summers outdoors, whether that be helping our grandparents in the farms, whether that be on boats. And so there is an increase here for melanomas that we see. And then there are other risk factors that are going to be your ethnicity. So fair complected, blonde hair, red hair, people who have a lot of freckles, those are going to increase your risk as well.
Really? Okay, that's interesting. You mean real blonde hair, not fake brown hair, right?
Correct.
So I might be a little more in the clear.
Safe. And your family history. So if you've got a family history for melanomas or basal cells or squamous cell, you're going to have a higher risk of developing those as well.
Okay, so you say melanoma is the most deadly. Is it
Correct.
deadly because we just don't catch it in time, or what makes it so
It's
dangerous?
more aggressive. Not necessarily. Normally, the ethnicities that it's not caught earlier in are actually our dark complected individuals. So Hispanics, Asians, and African Americans are more likely to have it be more aggressive at presentation. That's also because it's normally not on a normal body surface. So normally those present on the bottom of the feet or underneath the toenail for our darker complected individuals.
Question. Underneath the toenail, how do you even catch it if that's where it's at?
You have to be diligent in doing I always tell people you have to know your body, whether it's women knowing their breasts, doing breast exams, the same goes for your skin. So you have to be aware of, your moles. If you have something comes up or changes, those are red flags that you need to get in and be evaluated. And the same goes for underneath your toenails. If all of a sudden something black, comes up under your toe, you might think it's a bruise, but it's always safe to be, better to be safe than sorry and be evaluated.
My toenails are never not painted. Honestly, I feel like next time I get a pedicure, I'm gonna be like, hey, hold on, let me look real quick and see what's going on over there.
We've had several patients who've had it underneath their toes or underneath like a fingernail or thumb. So just have to know your body is the best advice I can give to anybody, is being aware of what's your normal. And if something comes up, or comes up fast, that's a red flag, or changes if you have a mole that's changing.
Okay, so are there any other signs or symptoms that you might see besides a mole or the toenail thing?
So it kind of, again, if you're out in the sun a lot, like we are here, so melanoma is going to be the most common skin cancer in younger patients. As we age, our increase for the basal cell and the squamous cell will increase. For women, your chances of melanoma, this is going to be for our non-Hispanic white females, your chances for melanoma are greater under the age of 50. if for men, your chances of melanoma are non-Hispanic white males, that increases over the age of 50. So it kind of flips. But as we age, especially if you're someone who's out in the sun a lot, you're going to start developing things on your nose, your ears, your face, the sun exposed areas. So your arms, those are all going to be common sites. So that's going to be, what you're looking for. But basal cell and squamous cells, those usually occur in our older population. Not saying melanomas don't occur in older populations, but you're going to see those in our women under 50 more likely than you would see a basal cell or a squamous cell.
Okay. So you've mentioned that know your body. So does that freckle look different or something? What would be something that we need to look for exactly in that freckle or in that mole that would make us want to give you a call?
So there's a lot of acronyms out there. There's the ugly duckling. So if you're somebody who has a lot of moles or a lot of spots, if all of a sudden one of those spots doesn't look like your other spots, that what we'd be called the ugly duckling, that would be something that you would want to bring to the attention of your provider for evaluation. And then for your moles, you're looking at the A, B, C, D, E. So A is going to be the asymmetry. So it's not perfectly round. It kind of has, jagged edges. B is going to be the border. Again, going back to the edges. C is going to be the color. So if it's a lot of times for melanomas, they're either real black or real dark. D is going to be a diameter greater than 6 millimeters. So that's the size of a pencil eraser. So starting getting bigger than that. And then E is a newer one that they've added, which is evolution. So again, that goes back to that spot is changing. It's not consistent. So I harp on you have to know what your spots look like. But if you all of a sudden have something that comes up real fast, that's raised, the borders aren't regular, the color's kind of off, that would be something you would want to get looked at.
Okay, so for someone who maybe doesn't have a history with skin cancer or doesn't run in their family, should you be getting screened regularly or see a dermatologist annually?
It's going to depend on your risk factors as a child growing up, what you were exposed to. So if say you don't have a family history for skin cancer, but you spent your time in the sun, maybe you've had a lot of sunburns in your life. 5 sunburns as a child increases your risk of developing skin cancer. If somebody who spent time in a tanning bed, those are all going to raise your risk of developing cancer later in life. So even though you may not have had a skin cancer yourself, or there's no family history, because of what you increased your risk factor, the same as someone who smokes by doing those things with, not wearing sunscreen, not protecting your skin. So those are going to be indications to have annual skin checks. And honestly, once you see the dermatologist, for your first evaluation, it's very intimate. If you haven't had one, your dermatologist, you should be completely, naked with a gown on, and then they're going to have usually a kind of looks like a magnifying glass. And they're looking at all your spots, and they're going to kind of let you know, hey, everything looks good. I think we can do every other year. Or, hey, I need to keep an eye on this spot, and we're going to need to see you every 6 months or once a year.
We love a good heads up when we're going to have to be
Yeah.
naked and prodded over. So thank you for telling us about that.
And don't be scared. I mean, that's a good dermatologist. You want someone who's going to get in there. A skin check should be your whole skin. It shouldn't just be your face. It shouldn't just be your arms. So, being undressed really is going to give them the best, look at your skin and let you know what your spots look like and if there's anything you should be concerned about.
Okay.
We've talked a lot about the sun.
Mm-hmm.
But are there other things that we're doing that is causing skin cancer, or is that truly the only thing?
Well, I grew up in, the 90s and early 2000s, and I remember we loved tanning beds. Mm-hmm. There's a lot of us who still like our tanning beds, but we know that the same as smoking, the evidence is there that raises your risk of lung cancer. Your exposure to the sun, and particularly burns, it raises your risk of skin cancer. So you're going to an artificial UV light that now that they have to put on your tanning bed, that is a carcinogenic exposure. So the same as on a pack of cigarette, that tanning bed has to have that same risk put on there. So people are aware by getting into that tanning bed, you are raising your risk for developing skin cancer later in life. So women younger than 30 are 6 times more likely to develop melanoma if they tan indoors. At all ages, the more women tan indoors, the higher the risk of developing melanoma. So, and sadly, this statistic says almost 30% of American adults at one point have used a tanning bed. So that's a high number there.
Don't ask us to raise our hands.
Well, I could raise my hand. I think, though, as a mom now, and as you know, we know our risk. As you know, we develop the risk of tobacco. Parents, stop smoking, voiced it with their children. And I think now, as a mom of 3 kids, I try to be really diligent in protecting my kids and putting those habits on them. Like when we're outside in the sun, we're wearing our sunscreen, we're wearing our hats. If we're really outside or like at the beach for a long time, we wear, the long sleeves, UV protected shirts, and just trying to incorporate that into our habits of teaching that we know the sun is dangerous. I'm blonde hair, blue eyed. So I know my risk is increased. I know my risk is increased because I used baby oil and I used tanning beds. But I don't think at the time we understood, we thought maybe tanning beds were a safer option to the sun back in the day. But now we know the evidence is there that that's not true. So tanning beds are a significant risk to developing melanoma.
So what are those sneaky things? Because I think we all know if we're going to the beach, we're going to be in the sun, obviously. But there are some other things that you mentioned earlier before the show that we were talking about that, like, you may not even think about it, but you are being exposed to either fake or real sunlight from these things. What were some of those things?
Well, I think other things to take into account is you've got to reapply your sunscreen. So you can't just put sunscreen on in the morning, spend 10 hours out in the sun without ever reapplying. So most of the time, sunscreen needs to be reapplied every 80 to 90 minutes, depending upon maybe more frequently if you're swimming or sweating, you might need to reapply sooner. Other things that you have to just in your everyday life, if you like to go to the nail salon, if you do the shellac or those types of nails, that's a UV light. So every time you stick your hand in there or your foot in there, that could be a source of getting that UV light. So just being aware that that's there. For people who are on the road a lot, traveling, if you're somebody who drives a lot, that driver's side arm, if you're wearing sleeveless or short sleeve shirts or even the side of your face, those are all going to be higher incidence of developing cancer on that side of the body. So those are just things to be aware of.
So with sunscreen, we've seen that now a lot of people are incorporating that into daily use, for example, like in your skincare routine.
Mm-hmm.
So, but you even hear, even if you're not going to be outside for a lot, still wear your sunscreen. Why is that important? Is it reasons like you just mentioned, kind of?
Well, there's a lot of good benefits to wearing your sunscreen. We know people who regularly wear sunscreen every day. You're going to reduce your signs of aging. So if you're concerned about that, we know that by wearing sunscreen every day, your chances of developing wrinkles, it's delayed. It's not as significant as someone else. You have, again, you're thinking, a lot of us, I work over at Joe Arrington. I have a great office. I have beautiful big windows. I sit in front of those windows all day. Mm-hmm. So you have to think about the sun exposure that's coming in through there. So daily sunscreen use is great. I try to teach my 9-year-old already, in the morning, we're just going to put sunscreen on as they're outside playing throughout the school day. And they're fair complected. So those are things that I try to teach. I think we've got to teach our kids young. I unfortunately was taught different things that now I'm trying to reverse as an adult and try and instill different habits in my children that, we didn't know about 20 years ago.
What kind of sunscreen should we be using? Because there's so much out there.
So you want to use an SPF of 30 or higher, and you just want to make sure it's broad spectrum because it's going to um, significantly reduce your UVB rays. So that's what you're looking for. I prefer mineral based. I think it offers you better protection with less chemicals in it. And there's a lot of great options out there.
I was at the store the other day and I saw an SPF 100. Does that protect you any more than a 50 or a 30?
They really say, as long as it's a 30, again, it's going to go back to reapplying it and how you're using it. So if you put it on once and you're out in the sun 10, 12 hours, likely you're not going to get the same benefit from a 30 that you reapply several times throughout the day.
Okay. I feel like we've given the sun a bad rap right now.
Yeah.
But can we, for a moment, just maybe bring it back to the fact that it does provide us with some good benefits, though?
Oh, like helps our mood.
Yes.
We get vitamin D naturally from the sun. Hey, I love the sun. The thing that you have to do, being out in the sun is okay. You just have to protect yourself. So, wearing hats, sunglasses. Melanoma can develop in your eye. It's not a commonplace. We do have several patients in this area who have had melanoma in their eye. So you don't think about it, but wearing your sunglasses if you're out a lot, our baseball players looking up, all of those things are going to help reduce your risk. So you can enjoy the sun. We don't want you not to enjoy the sun. We want you to make smart choices when you're in the sun, protecting yourself, protecting your kids, so that you live long, healthy lives without complications.
You said protect yourself, protect your kids, and all I can think about is my husband, who if I literally do not say, did you put on sunscreen today? Do you want me to put on your sunscreen today? He will literally not do it.
I don't think men necessarily have the same concerns as us. My husband's a golfer, and it's the same. I'm a fisherman. So I buy him, the long sleeve fishing shirts, the hats to try and encourage it. Put a little, bottle in his golf bag.
Yeah.
The bag he has to wear when he's out there.
Same. Sometimes it's those sneaky things that we do that are like,
Yeah.
maybe, what is it, like the Jedi mind tricks where it's like, you don't know that I'm protecting you, but with this long sleeve, I sure am, bro. Okay. How is skin cancer usually treated?
So it's going to depend on the type, but for almost all your skin cancer, surgery is going to be the treatment of choice. So you're going to want to see a dermatologist. Most of the time, a dermatologist can handle your basal cells and your squamous cells in the office. They remove those. Your melanomas are a little bit harder to remove because, as we know, those are the ones that are a little bit more dangerous and deadly. And so those normally require, after the dermatologist diagnoses those in the office, you normally have to see a surgeon. So if it's on the face, a lot of times you're seeing a plastic surgeon. Other places on the body, you're seeing a general surgeon, and they're going to do what's called a wide local excision, where they're going to go in and cut that spot out and a certain amount around it to make sure the margins are clear. And in addition to that, a lot of times they're going to sample lymph nodes. So if it's up high on your back or on your face, sometimes they're going to take a lymph node sample from your neck or underneath your arm. If it's on your leg, they'll probably take a lymph node sampling from your groin. Most of the time, if it's an early stage, that's all that requires is the surgical removal of it. I will say that new guidelines, though, are recommending immunotherapy, which is a newer type of treatment, and that's even in stage 2 melanomas. So if you get diagnosed with a melanoma, my recommendation is that you see an oncologist because they're going to look at your pathology. They're going to decide if you need anything else done or if the surgery that was done was sufficient. So a lot of times I think people don't know, oh, I had just that removed. It's still a good idea to get an opinion from an oncologist because, as I said, the most recent guidelines, even for a stage 2 melanoma, a lot of times now we're recommending a year of immunotherapy to help reduce your chances of recurrence and it coming back.
Wow.
So how often would you say it's pretty common that you see that come back?
Out of the skin cancers we've talked about, really, they can all recur. So if you have a basal cell on your nose, they can remove it. Basal cells don't typically spread, but if they're not taken care of, they can create, some ugly lesions on your face. They can cause, cosmetic damage, tissue damage, nerve damage in that area. We don't usually see those spread anywhere else. They can reoccur if they're not removed all the way. Squamous cells are kind of, I would call our middle of the road skin cancers. Those can reoccur too. Very rarely they will go to other parts of the body, but those are not as common. Melanoma is going to be the skin cancer that can come back and that can spread and that can be very dangerous. I don't want to downplay squamous cells. As I said, they're middle of the road. They're not normally as aggressive as melanomas, but you should still be followed. You should still get your frequent checks and you should still know red flags to look out for. So, unexplained weight loss, if you all of a sudden start developing drenching night sweats or swollen lymph nodes, those are all, concerns that should be addressed by your provider.
I'm trying not to sound vain,
hmm
but from what I'm learning from this conversation is A, the skin cancer is detrimental to your health.
Mm.
But B, for those of us who spend a lot of time, money, energy on our appearance, skin cancer is detrimental to that.
Correct. It can be. It can create cosmetic issues. My mom has had a basal cell from her nose and had to have it removed by a plastic surgeon. So we want people to enjoy the sun, but we want people to enjoy the sun safely. So just, our hats, our sunglasses, our sunscreen, those are all going to help, decrease your development of skin cancers. And as someone who's aging, who's used tanning beds, and now it's like I'm trying to reverse the wrinkles. So I think, if I never would have gotten in a tanning bed, I wonder, what my aging would have been. So
I do love the sun, but I also
Me too.
don't love wrinkles. So
there you can try there's the tanning lotions,
Yeah.
things like that.
Self-tanners.
The self-tanners, which are a safer option that we know of right now. So just
I love that you say right now, because in another 10 years, we're going to have this conversation
Well,
where it's like, please don't drench yourself in.
science is constantly changing. Healthcare, we want it to be evidence-based, science-based. And so, I know that my grandparents probably thought cigarettes were fine back in the day, but that's healthcare. That's life. We know things that we used to think were safe for us are not safe anymore. That's why everybody now wears their seatbelts and we put kids in car seats because we have the evidence to support those things. So you just have to be open to the new evidence and you constantly have to be open to change and what's happening.
It's a great way to put it. Well, thank you for being with us today.
Uh-huh.
Before we let you go,
I'm not trying to scare everybody out from the sun. I just want you to, make better choices than I did as a youth. I would say avoid tanning beds altogether, but
Brooklyn and I do this podcast, and we've done several of these episodes so far. And I will say, I do go home and go, like, I think I've developed a little bit of hypochondria.
Me too.
Now from these conversations.
reevaluate your life choices.
A little bit. Like, I think I do try to stay out of the sun, but now I'm like, oh, maybe I should go
Don't stay
back.
out of the sun. Just protect yourself when you're in the sun.
Right.
I'm definitely more aware than I was
Correct.
5 years ago.
Well, I will
probably.
say, being in this field now since 2012, I'm definitely, more aware of things that I wasn't growing up. So it's just you got to evolve.
Right.
Mhm.
So that's what we're doing. We're evolving.
That's right.
Yes.
And part of evolution, I feel like, is trends. So we've gotten to that point of our show where we're going to have you talk about a trending topic related to skin cancer.
Okay.
All right. So read what your topic is.
Have your hairstylist check you during your appointments. And I think that's a great idea. It's another one of those sneaky places that we may not think about. Hey, I can get skin cancer there, but you can develop skin cancer on your scalp. So during your, hair wash, your hair appointment, having your hairstylist evaluate. That's actually how my mom found hers, was her hairstylist said, "Hey, you have this area on your scalp that looks funny." And then she brought it to the attention of her provider, and it was a basal cell. So they can be your ally, they can be your advocate. So, when you go to your next appointment, say, "Hey, while you're scrubbing my head, do you think you can take a look for any abnormal, ugly duckling spots on my scalp?"
I will say the scalp is one of the spots I forget to put sunscreen, and then it always peels. So
Right.
it's something you don't really think about.
And they actually make sunscreen now for your scalp and your hair.
Well, Stacey, thank you so much for
Huh?
being here today.
Thank
Thanks for all of your great information. If you guys have any questions, follow us on social media, send us your topic ideas, and we will see you next time.
This podcast explores health-related topics with experts in their specialty for entertainment purposes only.
The information shared and discussed should not be considered as medical advice under any circumstance and is not intended to replace professional medical advice.
The views expressed do not reflect the views of Covenant Health System. For questions related to your personal health, always contact your physician. Painful periods, trouble getting pregnant, and hormonal chaos might not just be bad luck. PCOS or endometriosis could be the culprit. Tune in to learn what's really going on and how to take control.